This video is a continuation to my previous video on eligibility verification. If you have not watched that video, the link is in the I button. Now, in the previous video, we discussed that the first step in the revenue cycle management process is patient registration and appointment scheduling, which is done at the doctor's office. And the second step is eligibility verification, which must be done by the billing office. Now, in order for us to do eligibility verification over the call with the insurance company, we will need the provider details like NPI, tax ID, and the provider's name or the doctor's name. At the same time, we also need patient details like the member ID or policy number, group number, patient's full name, and date of birth. Now, this information is forwarded to us by the doctor's office in an Excel format as shown below. This Excel will contain details like patient's name, date of service or date of visit, type of appointment, whether the patient is coming in for an office visit or a lab test or for any other service or procedure. It also contains details about the patient's insurance, the name of the insurance company, the member ID, and the group number. As you can see from the Excel, this practice contains multiple providers, which means it is a group practice. In the US healthcare system, whenever a clinic or practice contains more than one provider, it is considered as a group practice or a group clinic. Now, please keep in mind that appointments must be scheduled by the patient 48 hours ahead. This gives enough time for the doctor's office to verify benefits and eligibility with the patient's insurance company. Also, if it is an emergency, patients can directly walk into the doctor's office without appointment. Now, let us look at the details that we need to confirm from the eligibility verification call. The first thing is the policy effective date and termination date, that is, the policy start date and end date. If the termination date is none, it basically means the policy is still active. As you can see from the policy status column, it is mentioned as currently active. Now, before we move on to the next column, there is one important thing you guys need to understand, and that is the difference between a policy and a plan. Now, remember, policy is nothing but the name of the insurance company that is issuing the policy to the member, like Aetna, Cigna, UHC, etc. But the patient's medical coverage or benefits are based on the type of plan the patient has under that policy. For example, a low premium Aetna plan is called as an HMO plan, and a high premium Aetna plan is called a PPO plan. So always check eligibility in reference to the patient's plan under a policy, especially when checking network participation status, that is, whether our healthcare provider is in network with the patient's plan or not. For example, the provider may be in network with Aetna but only with the PPO plan and not the HMO plan, which basically means the provider is not in network with HMO. Now, the Excel we are looking at belongs to a specialist clinic. And under a low premium plan, which is an HMO plan, patients do not have direct access to specialist clinic. They need to get the initial checkup done at the PCP office, and only if the PCP feels that further treatment is necessary, then the PCP will forward the patient to the concerned specialist. Now, this process of forwarding the patient is called as referring. And during this process, the PCP office will generate a referral number which is needed by the specialist office for their claim to get processed and paid. So as you can see here, if a patient has a HMO plan, then it requires referral from the PCP. Also, we need to confirm if the patient's policy is linked to a HSA, which is a health savings account. If you need more explanation about HSA, you can refer to the video in the I button. We also need to confirm the dollar amounts for the costs associated with the patient's plan, like copay, coinsurance, deductible, and out-of-pocket maximum. We also have to confirm the costs associated with the lab services. And lastly, we need to update the call details, like which number we called and the name of the insurance representative to whom we spoke with, the call reference number provided by the insurance representative at the end of the call, date and time of the call, and the name of the AR agent who verified these details. Hope this video provides a clear insight into the eligibility verification process. If you have any questions, please feel free to comment. Thank you.